How long were you a cop?
Oh, 17 years.
17 in New York City?
New York City, yes.
Val Valentini took an oath as a New York City police officer to protect people and value human life. But when he asked his insurance company to provide the same type of care to his wife, he says it failed.
You know, and it's frustrating now. At the time, the anger was, I can't even explain it, you know, even on her part.
As Kathleen Valentini's hip pain worsened, doctors ordered an MRI to investigate a suspicious mass that turned up in an X-ray, but her insurance company denied it.
So her doctor told her, I want you to get an MRI because I feel like this is what you need. And then the insurer, who never saw her, said, no, you're not getting it.
That's exactly it. And then when they denied it, again, they asked that she do physical therapy first.
But Kathleen had already done physical therapy, so her medical team appealed. Nearly 6 weeks later, Kathleen had that MRI, which confirmed she did in fact have bone cancer. But doctors told her the diagnosis had come a few weeks too late for the treatment to be simple.
They failed her so miserably, and from beginning to end.
The cancer was aggressive, a fast spreader. Doctors had to amputate her right leg, hip, and part of her pelvis.
So the delay by the insurance company forced her to need amputation?
Yes, 100%.
How do you process that?
I can't. Because she suffered for no reason.
Kathleen's insurance plan required her physician to obtain prior authorization for the MRI, a process used by most commercial health insurance companies. It's when doctors submit a request to the insurance plan and it decides if it will provide coverage, often based on whether the company thinks the test or treatment is necessary.
Prior authorizations are dangerous. They were created to root out waste and inefficiency. That's not what they're doing. They're building the bottom line for the insurance company. And when you put profits over people, that's not right.
In November of 2020, Kathleen Valentini lost her battle with cancer. At the age of 50, she left behind her husband and teenage son.
It's unspeakable that insurance companies and their subcontractors in the name of profit can do this.
Is this all about profit?
I think so. I think so. That's the only reason for prior authorization.
It's all a roadblock designed to save the company money.
Justin Williams gave TikTok viewers a behind-the-scenes description of how he remembers the prior authorization process.
The whole prior authorization process is designed to take as much time as possible.
He worked for a major health insurance company for almost a decade, his team processing electronic faxes of requests from doctors as they came in.
So every one of those faxes coming in would be someone's hospitalization, somebody's medical equipment, somebody's treatment.
Many states have laws for how long insurance companies can take to make a prior authorization decision, depending on the kind of request. Williams says over time, bosses pushed his team to focus on new and different duties. The queue of unprocessed fax requests backed up into the thousands, often pushing each prior authorization to the maximum amount of time.
It basically became clear to me that the primary function of the insurance company was not so much getting things done in a timely fashion.
Employees in departments like Justin's, those responsible for the first stage of processing requests, often aren't required to have any healthcare background at all. We found numerous job listings where representatives only need a high school diploma and customer service experience, and found online resumes of prior authorization employees whose previous work experience was listed as things like working at a hardware store or being a supermarket cashier, with education in areas like cosmetology or landscape architecture. Companies note these employees are not making clinical decisions, but some jobs include working directly with request case files.
I think we need to embrace all kinds of workers in healthcare, but it is important the level of experience and training that you have, and so we should have people acting appropriately based off of that.
Research shows the practices of physicians like Dr. Gabe Charbonneau spend around 14 hours every week on prior authorization paperwork in dealing with insurance companies instead of treating patients.
I actually think it is insurance companies practicing medicine.
He also says there are frequently initial processing mistakes, like not noticing things a doctor would, like denying a prescription only to suggest an identical drug.
My nurse actually brought it to me and she's like, am I reading this right? I mean, it was very confusing. It was like, okay, so it says the medication is the one that's denied. This is the medication that's recommended, but aren't they the same thing? And I was looking at it, I'm like, yeah, they're exactly the same thing.
Sometimes he even has to fight with doctors employed by the companies to try to get treatment approved.
It's hard to have your judgment questioned all the time.
Another part of what makes the process so hard to navigate for providers and patients, not all insurers have the same rules. We looked at the publicly available policies of nearly 100 insurance companies, trying to see if those insurers required prior authorization for some of the most common procedures and tests, things like CT scans, cardiac stress tests, sinus surgery, and knee replacement surgery. Prior authorization requirements for the same service varied company to company, and sometimes state to state. According to the standard policies published online, most patients who have Emblem Health coverage do not need prior authorization for a basic cardiac stress test, but those who have certain United Health plans do. Oklahoma Blue Cross Blue Shield customers need prior authorization for outpatient sinus surgery, but Massachusetts customers do not.
It feels like it's this roadblock that's intentionally put in the way that everybody has to deal with, no matter whether you're right or whether you're not right.
We tried to interview representatives from the insurance industry for this story. A political advocacy association representing health insurers refused to make someone available.
Health insurance providers use medical management tools to help patients get the right care at the right time in the right setting.
But in 2018 testimony to Congress, the group says prior authorization has been effective in addressing overuse and misuse of tests and procedures.
With prior authorization, our members analyze whether a treatment is safe and effective for a particular patient based on the best available clinical evidence. Insurance providers also ensure the treatment is provided in the most appropriate care setting by a qualified licensed provider, and it is provided with other needed services.
By making these decisions, people like Val Valentini and his attorney allege insurance companies are actually practicing medicine. The family even tried to sue their insurer for medical malpractice. But the case got dismissed because in New York, as in most states, there are no laws holding insurance companies to the same standard as doctors.
What they're doing is disgusting, and it's getting worse and worse, it seems.
Because while insurance companies say prior authorization benefits everyone, Valentini is left feeling like the system puts companies in charge of giving permission to practice.
You know, the insurance wasn't there for her when she needed it. So who's it helping? I don't know. It certainly didn't help us. It's certainly making the doctors' lives more difficult because it seems like the insurance companies are getting in the middle of doctor-patient. So who is it helping? I guess it's helping them.